Introducing the all-new Corolla.
It is perhaps one of the more comprehensive teams of doctors and nurses dispatched to a medical mission, and they're from Guam. As the team arrived to its second mission site in Sogod, Cebu, hundreds had already filled the Durano Sports Center. The doctors have wasted no time in ensuring that this medical mission gets underway as soon as possible. Not even 15 minutes has passed, and as you can see, patients are already being assessed. Among the first procedures performed was a tooth extraction. Orthodontist Dr. Roger Kaneshiro is experienced in medical missions to the Philippines. He's even picked up some Tagalog words to be able to communicate better with his patients.
You go inside, it's called an elevator, and it's kind of like a screwdriver. You just stick in between and pry a little bit, makes the tooth a little loose, and then you can remove it. And there we have our tooth. If it would hurt, she would have told me right away. Hang on. Okay, tapos na.
Next, we visit surgeon Dr. Ricky Sabio in his makeshift surgical room. At this very moment, Dr. Eusebio is performing his very first surgery this morning. He's removing a cyst from the back of a man's neck. Minor surgeries like this were quite common. Some may not have directly resulted from the destructive Super Typhoon Yolanda that had just trampled the area 2 weeks earlier, but many were lifelong chronic illnesses that urgently needed attention anyway, like this dental patient who had probably never seen a dentist in her life.
This is one of the sad moments. She's 12 years old and I took out her 4 front teeth.
Then there were illnesses that could have been brought on by the recent weather, like viral and bacterial infections. One patient, 4-year-old Ken, appeared to have an infection. He was brought in just as his temperature started to spike to dangerous levels. In the middle of a seizure, he already appeared lifeless. It was a frantic scene as doctors and nurses rushed to bring the boy's temperature back down.
Go for IV, bring him.
Does she have tape?
We don't have tape.
Okay, I got tape. Hold on.
What's his step? 103. Is he stiffening again? Oh, it's even going higher.
What is the medicine in the IV?
That's just a hydration, just for cooling him down. We're gonna put some antibiotic to the IV line just to get the infection to go away. But right now the key is just cool him down.
And within just a few minutes, little Ken went from lifeless to alert. Indeed, some might say this was nothing short of a miracle. Each of the general practice physicians served hundreds of patients in one day for this medical mission. Certainly not the amount a practicing doctor would see at a clinic or even at a hospital emergency room. Dr. Juan Nguyen calls it field medicine, where diagnosing fast and under pressure is your only option.
I can see like about 400 patients a day. It's a different type of medicine. You don't see the patient as in the clinic. We basically look at them, listen to the complaint and just treat. So because you have to serve all the numbers, so you don't spend 5-10 minutes per patient, or you never go through with this line.